the UK is facing a new drug crisis: ketamine. A powerful anaesthetic, in recent years its use as an illegal recreational drug has exploded.
When I took Ket for the first time, it was like nothing else.
It feels like somebody is cuddling you, but then it's like the devil in disguise.
Hospitals are being inundated.
By February 2024, it was like a floodgate opened.
And it's found its way into schools.
They were mainly years 9 to 11, so 14 and above. We're really shocked. To us, ketamine wasn't something that was talked about.
I'm Hazel Martin, a BBC journalist. Last year, I made a very personal film about the harm alcohol had done to my body. Now, I want to explore the damage ketamine is doing to a new generation.
I've worked in healthcare for 25 years. I have never seen something so destructive in all of my time.
Six people have been charged as part of a Lancashire police operation to tackle the supply of ketamine.
It seems like every week there's a new headline about ketamine and its impact.
Liverpool has a growing ketamine problem, described as worse than heroin in the 1980s.
And from what I can see, there's a particular hotspot: the northwest of England. I've come to one of the UK's biggest summer festivals, just outside Manchester. People are out in numbers to see their favourite headline acts, dance and have a good time.
Do you think you'll see many drugs about this weekend?
People doing drugs at festivals, that's just is how it's always been.
What kind of drugs do you think you'll see the most of?
Ketamine.
Ketamine?
Ket is quite a big one. Yeah, like horse tranquilizer, right?
I think ketamine has become more of a craze, but I don't understand why.
The festival says it operates a zero-tolerance policy to drug taking on site. People are searched before they come in. Some drugs are seized or voluntarily handed into amnesty bins. Since 2013, a charity called The Loop has been testing drugs at festivals to find out what's in circulation.
Talk to me a bit about what you've been testing today.
We're receiving samples in potentially from the medics, from Amnesty, from gate seizure, and when we're testing hundreds of samples in a weekend, that gives us a really broad picture of what is on the drugs market within the region. We have a really wide range of different samples. We'll have cocaine, MDMA. This is a bag of ketamine. There's about 2 grams in there. So this is potentially an amount that a person might bring in for their own supply.
Have you noticed any rise in popularity in that drug?
Across all the events that I've been working at, we've seen over the years just this incremental increase in the popularity of ketamine each year. And now we're at a point where, yeah, we would be 3 out of 10 or 4 out of 10 samples is absolutely unsurprising to us as a regular ratio.
It's estimated there are almost 270,000 ketamine users in England and Wales. And since 2013, ketamine use in 16 to 24-year-olds has increased a massive 231%. Ketamine is used medically as a quick-acting general anaesthetic and painkiller. It began being used recreationally in the UK in the late 1990s. I'm meeting a leading criminologist who's been studying club drug trends for the past 30 years.
Ketamine, from your perspective, do you have any insight into why just suddenly this craze seems to have happened?
Partly it'll be about access and price. At the moment, it's very, very cheap, £5 to £10 a gram, depending on how much people buy. This is pocket money price, and it's cheaper than alcohol. But also there's something about that escapist element that particularly appeals to people at the moment. You know, people describe it as fun. It makes their arms and legs go a little bit wobbly. It's a little bit of silliness for half an hour, and that's particularly appealing to young people at the moment.
How dangerous is it as a drug?
We know that a one-off dose of ketamine is unlikely to be problematic for most people. The real issue is with the regular and prolonged use. If people develop a daily dependency, that is where the problems start to develop.
I'm travelling to just outside Liverpool, to one of the busiest A&E departments in the northwest, to find out what prolonged use of ketamine can do to your body.
Can you tell me when you first realised that there was an issue?
So I think it was probably around 2023, but we started seeing a lot more younger people come in with severe abdominal pain, problems passing urine, blood in their urine. We started to see a bit of a pattern. A lot of these patients were coming in multiple times with the same problem that might have initially sounded like they had a bit of a bladder infection, but when we've looked back, their urine has always been negative for infection, and they were coming in repeatedly with the same thing. So that was a bit of a red flag for us. We've always known people have used ketamine, but I suppose we weren't really aware as a group of medical professionals of the exact problems that could happen with ketamine and the bladder issues that could come about.
With their A&E facing a surge of young patients with severe bladder problems, last year the hospital trust decided to act.
So I've labeled here that we have taken a urine sample from the nephrostomy. We just need to send it so that we can make sure that there is no infection. Thank you.
Consultant urologist Ahmed Omar set up a new direct referral to his clinic to help treat ketamine users.
By February 2024, it was like a floodgate opened and a huge gush of ketamine patients started. And this is where the true magnitude of the problem became obvious to me, because the stream of the referral became constant. Sometimes I received 4, 5, 6 per week.
Today, Mr. Omar is checking on one of his patients. The lining of her bladder was so severely inflamed that it shrunk to a point of being unusable. She needed major surgery to drain urine directly from her kidneys. It's hoped if there's sufficient improvement, the bags can be removed.
If we just take a urine sample, I think from this one? The urine one, yeah.
Okay.
Let me put it this way. If we think of ketamine like a heat gun, the longer you apply the heat gun, the more shrink happens to the point that things become unusable after that. The bladder is already completely damaged. The patient is leaking urine, sometimes bleeding all the time, and they ended up needing, what we call nephrostomies. These are tubes outside to drain the kidneys. The inflammation and the damage to the bladder. Ketamine can cause intractable pain. And because of this, some of these patients have to go back to ketamine to manage their own pain. So it is a vicious cycle. We have seen as young as 13 years old.
13?
Yes, 13 years old. Not only as a doctor, but as a father, when you see these young with this degree of bodily damage. And some of them, they do not realize, the damage they did to themselves. NHS is not geared to deal with this, type of problem. Such large number, influx really. It's looked like an epidemic really in the region.
In the last 18 months, Mr. Omar says he's seen more than 130 ketamine patients, 70 of them since January. Most have bladder problems, but ketamine use can also damage other organs, like the liver and kidneys. One of Mr. Omar's patients is a teenage boy who's in hospital in a critical condition. It's so serious, if he deteriorates further, doctors won't resuscitate him. His mother has agreed to speak to me. She's asked not to be identified to protect her son's privacy. An actor is speaking her words.
Can you take me back to the beginning?
When he was 15, 16, he just came to me early one morning, and said he's been getting tummy pains and it's hurting when he wheezes. And he said because I'd been taking ketamine, but I didn't know what it was. So I got him an appointment with the doctor that day, and even the doctor didn't really know anything about it. He just gave him antibiotics and sent him home. It's only the last 2 years where he's been in hospital over 30 times? He's been in resus twice, where he's nearly died that night. and now he's in hospital again.
You showed me a picture of your son from a few years ago, and he looked like any other healthy teenage boy. How much has his appearance changed, and in how short a time frame?
Within 2 years, he literally went to 5 stone in weight. He couldn't walk properly. His kidneys, both of his kidneys, failed. His liver's damaged, his bladder's damaged, every single organ's damaged now. They said if his heart stops, they wouldn't resuscitate him. They wouldn't bring him back, because it would do him more harm than good, they said.
I can't quite believe what I've just heard. In just 4 years of taking this drug, a boy has gone from a healthy teenager to near death. And he is just one of many patients who have come through this clinic. I want to understand why people turn to ketamine and stick with it, despite the harm it can cause.
Take a look at this study. It was conducted by academics from the University of Exeter and University College London. It was published in April this year, and it's one of the first major surveys in Britain of people who use ketamine to excess. And the findings are surprising. There are several reasons cited for using this drug, including dissociation and psychedelic effects. But surprisingly, over half said that they turned to the drug for self-medication. And when they tried to stop, many said that they experienced severe withdrawal symptoms like cravings, low mood, and anxiety. What's interesting to me about this is that many people seem to be turning to ketamine to deal with underlying mental health issues, but they're then becoming reliant on it.
I'm travelling to the Wirral, to the Birchwood Detox and Rehab facility, part of the Kaleidoscope House charity. I'm here to meet 30-year-old Nicole, who's currently in treatment. Her care is funded through her local authority.
Where did this all start for you? When did you first start taking Ket?
It was the 6th of November in 2021. I just remember my friends having some Ket, and I took it and I was like, wow, this is it. Like, this is my drug and this is my beliefs, a saviour.
And what do you think that the appeal was for you?
I've suffered massively through my whole life with mental health. Yeah, the childhood was bad. I was first diagnosed with depression when I was 14. Taking ketamine helped so much. It really did. The disassociation, the strip of reality, the just sitting there with the warm, fuzzy feeling. It feels like somebody is cuddling you, but then it's like the devil in disguise. Like, it was all it was doing was numbing me and taking me somewhere else. You know, I still had to come back to reality and deal with reality. It doesn't last forever.
At her peak, Nicole says she was using 14 grams of ketamine a day. Her kidneys were failing, and her doctors told her she might die.
And they were just like, you just need to stop taking ketamine. And I'm like, but I need help to stop doing that. I just felt like a bomb ready to explode, and the ketamine was just relaxing me, but then it was also, it just ruined me at the same time.
Do you ever think, I wish I'd never found it?
Yeah. Yeah. I feel like I'm in jail just being in my own body.
I just want to check in and ask if you're okay, because that's a lot.
Look at me.
Are you okay?
Yeah.
Since being admitted to Birchwood for detox, Nicole's physical condition has improved, and she's getting mental health support. Nicole is one of a growing number entering rehab. Over the last decade, the number of ketamine users starting treatment has risen 8-fold. Managing Director Joe Moore has seen the growing problem firsthand. Joe says the damage ketamine causes can become apparent much quicker than with other drugs.
I've worked in healthcare for 25 years. I have never seen something so destructive in all of my time. The heroin users can have used for 30 years and they don't have anything like these physical health, mental health conditions that we see with our ketamine clients in a very short period of time. So I think for me, we see ketamine as a totally different entity that we need to focus on because it's on its own par. There is nothing that I've seen that is likened to it.
In the aftermath of COVID, Jo began noticing a surge in ketamine referrals linked to mental health.
When we do look at COVID, a lot of people look back at that time and say, actually, it was very, very difficult. They were very lonely, very isolated, and they started to have this anxiety and depression creep up. And because it wasn't dealt with at the time, it's become a kind of way of life for them. And with that lack of support available, the lack of assessments, they've reached out to ketamine. They found it on a night out. It made them feel a certain way and they enjoyed it at the time. And then they continue to have to use to get through that, to be able to function in life. And it is, as we say, complete escapism from reality now.
How much behind the curve are we in understanding ketamine and its impacts?
We're really behind. We're not ready because there are not the assessment tools in place. We're so behind that it's going to hit us. It's going to get worse.
I'm beginning to see why people use ketamine, how they can become dependent on it, and the difficulties that they can have getting clean. But what I don't understand is how is it so easily accessible?
I'm in Manchester to meet an academic and drug policy consultant who's been researching the use of illegal drugs. Dr. Josh Torrance realised there was a huge lack of data on the pricing of ketamine. To fill the gap, he began analysing what was on social media apps.
I think there's a few drivers to kind of this ketamine bubble that we've seen since about 2022. I'd say probably the most significant reason that we're seeing so much ketamine now is price. Life is expensive. The price of everything's gone up. Fuel, food, beer in pubs, but ketamine's cheap. I was collecting data for a period of about 18 months. And when I started, a kilo of ketamine was £8,000, right? And I watched the price of a kilo of ketamine tumble down to about £4,000, and it's been at around £2,000 for a kilo of ketamine for a little over a year now.
A kilo of cocaine is currently more than 10 times this price, at around £21,000.
So tell me, what are the main ways that people are buying drugs?
I think there's been a transition recently to people buying drugs via apps. It's quite easy now to search through a plethora of different apps, certain keywords, certain areas.
Online drug dealers often use social media apps like Instagram, WhatsApp and Snapchat.
So if I go, say for example, like if I was to search Ket, Glasgow,
Sure.
to see what comes up.
I have no doubt there'll be plenty of people coming up.
Accounts, dozens of accounts. Wow.
So you could go from, not knowing anyone, searching on a social media app, to arranging someone coming to your house within the hour.
One of the most sophisticated drug markets online is via the social media app Telegram.
Telegram is an app that's kind of favoured by quite a lot of dealers, particularly dealers who send drugs through the mail, because they will have layers of encryption between their accounts and their device. So you could order a kilo of ketamine at a time, and it will sometimes turn up the day after you've ordered it in the mail.
So you get, pictures of the product.
Yeah.
Reviews.
Yes, yeah.
It's like a market,
Yeah.
it's
Yeah,
like
yeah,
Amazon.
Yeah, oh yes, yeah, it's the Amazon drugs, yeah.
On Telegram, sellers provide lists of products that buyers can browse, shopping around for the best deal.
So you can see this guy, he'll do you a gram for £15, which is a little bit over market rate, but then he'll sell you up to 2,000 grams at a time.
2,000 grams, and then that works out at £3.25 a gram.
Yeah.
And that is so brazen. Like, there are dozens and dozens and dozens of accounts here selling all different types of stuff.
But this is the interesting thing about kind of buying drugs in the modern era. You know, you used to kind of have to know a guy, or you'd get referred by someone who knew the guy and you'd have to go meet the guy and be introduced. Now it's kind of available to anyone with access to the internet.
The government says it urges all tech companies to continue removing any content that could encourage the sale of illegal drugs online. This is vital to save more lives. We wrote to Meta, which owns Instagram and WhatsApp. It declined to provide a formal statement but says users of WhatsApp can't search for or advertise groups in the way they can on public-facing platforms. Telegram says it has greatly reduced illegal content by blocking search terms related to illegal activity. It also says that to potentially encounter illegal content on Telegram, a user would have to be personally introduced to it by one of their contacts. Snapchat says their guidelines prohibit promoting criminal activity like buying or selling illegal drugs. It says it uses technology to shut down dealers and work with police to take appropriate action. With ketamine being so cheap and available, how can children be protected? I'm visiting one head teacher who in 2021 discovered a ketamine problem in his school. When did you first notice that there was an issue with ketamine and what happened?
So it was part of coming out of the lockdowns that lots of schools were dealing with a rise in challenging behaviour, more distress, more anger, more trauma. And we noticed that there were some young people who were presenting in school in a particular way in terms of their behaviour. They were mainly years 9 to 11, so 14 and above. It's things like a reluctance to attend class, difficulty settling in friendship groups, difficulty accessing the curriculum. Their caginess, their reluctance to engage with things led us to ask certain questions, and that's what led us down the track that revealed that a very small number of children were using ketamine.
And what's your reaction to finding out that that's happening?
We're really shocked, because to us, ketamine wasn't something that was talked about. So there wasn't a knowledge base out there, and we had to find that and put it together ourselves.
Do you think, was this an issue in your school only?
When it started, that was the first thought I had, and I thought, God, this is terrible. We're going to be seen as a druggy school. So, yes, we were worried that it was just us, but it turned out not to be. I think the real lesson is that if you think something isn't happening in your school, then it is, and you're going to get a nasty surprise.
Rather than excluding children with drug issues, Ben decided to research ketamine and establish a team at the school to offer support and therapy.
One young man particularly springs to mind, who was the person we were most concerned about. We saw him attend in school under the influence of ketamine, and I remember him pushing away everybody, and we thought, we've lost this lad. This is only going one way. He's going to end up being excluded. It's going to be a police matter. He'll fall into the criminal justice system. But in the end, he was supported because we had an adult sitting with that child, coaching them, asking them questions, listening to them a lot. And after he left, he attended our awards ceremony and got his GCSE certificates. It was wonderful to see him. Children will always take risks. That's what they're programmed to do. So it requires a different approach to young people so that they're not criminalised and they're not viewed poorly, because we've got a very, very immature way as a country of talking about children and young people.
It's interesting that Ben's approach to tackling the ketamine problem in his school is to try to ensure young people aren't criminalised.
Under the Misuse of Drugs Act, ketamine is currently a Class B substance. It carries a prison sentence of up to 5 years for possession and 14 years for supply. But earlier this year, the government set up a committee to advise on whether it should be recategorised to a Class A substance, which would mean tougher penalties for possession and up to life imprisonment for supply. But would it work? Would it really reduce ketamine use, especially amongst younger people?
Across the UK, there are support groups for people with drug and alcohol problems, like AA or Narcotics Anonymous, but there aren't many specifically for ketamine. In Stockport, not far from Ben's school, a group of young former users decided to establish their own support network at the Acorn Recovery Project.
This group What's the kind of story behind it? How have you all found each other?
I went into my first rehab in 2021. There was nothing around for Ket back then. This time round, I was going, you know, to the AA, CA and NA meetings, and I just weren't getting the identification that I feel like I needed to feel understood and to move forward and to educate myself, I suppose, around ketamine and just feel that connection. So we had a few conversations here with staff, and we said, let's set one up, let's set a PLS-specific ketamine group up.
And how have you all found it to have people, you know, same age as you, in the same situation to speak to and support?
Yeah, so I think they're really good, because like I said, I was going to the NA meetings and wasn't picking anything up from them. So by going to the ketamine meetings, it was comfortable because I could talk about stuff that I wouldn't talk about, you know, like incontinence, so it's more personal, these meetings.
One of the things that the government is looking to do is to reclassify it to a Class A. Do you think that would make a difference?
No.
No, I don't.
I think there's a lot of time being wasted with this argument about Class A and B. Even if it did get made to a Class A, how many people does anyone in here know that said they weren't going to sell cocaine because it's a Class A, or they're not going to take it? Because I've never come across that. I think the amount of time and energy that's being put into this debate and trying to get stuff done about it could be being put into, you know, educating kids in schools and to getting people clean and rehabilitated.
I almost feel like it's our responsibility to be that pioneer, to show people it is possible to get through the other side of a ketamine addiction. I managed to get myself into rehab, and I look forward to life, and I want to make a difference for other people now.
On my journey across the Northwest, I've seen the impact that ketamine can have. And this isn't just a problem here, it's across the whole of the UK. If reclassification of the drug goes ahead, will it be enough to tackle the ketamine crisis?
Ketamine's dangerous. Classification makes sense. But it's as much about public health as it is about education and justice.
The main bulk of work to deal with this problem should be in the community, not in the hospital. Multidisciplinary work with the primary care, with the councils, with the police is more important.
We need that national response. We need a framework, a drug strategy just around ketamine.
I'm shocked to see so many young people struggling with ketamine and the devastating, life-altering impact that this drug is having on them. But I've been struck by the people who have direct experience of the damage that ketamine can do, who have really strong opinions about how to tackle the issue. They're telling me that it's vital that Britain turns the tide, and that if nothing is done, that the ketamine crisis will get worse and worse and worse.